going great.
Yeah.
I think at the point of time now, we've opened up the facility December 5th. We're entering our third month, and our expectations, we're exceeding our expectations where I thought we were going to be at this point in time.
Okay, the facility.
To oversee the patient care, to oversee the entire facility when it comes to the operations, the financial management, and also to maintain the vision and essence of what we created. Essentially what that is creating a healthcare destination that's unique to no other, not only here regionally, but nationally.
Mm-hmm.
It's certainly a facility that has tremendous clinical care, but it's all on an ambulatory basis.
Okay.
We will certainly start in our industry seeing more outpatient and ambulatory care. We believe that in the future, 98% of healthcare should be delivered on an outpatient and ambulatory care. So this essentially is a hospital without beds, and the clinical care component to that certainly represents that. We built it too small, to be honest with you.
Oh, okay.
Right.
Okay.
So we've seen some tremendous demand, which is great. What we're also seeing is an uplifting environment not only for our patients who walk in, but also an environment for our staff and physicians. The feedback is they really love to work in an environment like this. Certainly the vision was to create a healthcare facility that doesn't look like a healthcare facility, doesn't feel like a healthcare facility, or doesn't even smell like a healthcare
Smells
facility.
good.
So the high points, and it's really a word that resonates to everybody that I speak with, and uplifting. And again, I emphasize that it's uplifting for the patients, the families who come with our patients. As equally as important to me, it's uplifting for our staff and our physicians who work in the facility. I believe that the industry is looking at it more as a service industry where we historically haven't really thought about the patient experience, which is a little bit, interesting. Since day one, we are an industry that service patients when they need us most.
Yeah.
Society is changing. Society has some expectations on every industry, and our industry is certainly answering the needs of society. We're a society that's going more to a society that wants instant gratification, certainly wants consumerism, certainly wants a level of service. People have choices. It's more the value play than anything else. And the equation, obviously, for value is cost over quality. So if we have both of those pieces of the equation in place, they're really going to value our services very highly.
Okay.
When you walk into this facility, we don't want our patients to feel that they're walking into a healthcare environment. The traditional healthcare environment has only one type of seating environment, for example. In our patient lounges, we have different types of seating options. A patient can sit in a more private environment. They can sit in a more social environment. They can even put their laptop down in a high top and work while they wait for the physician. We're also giving them different options of registration. So today, a patient walks off on one of our patient floors and has the option to either register for the day through a kiosk, or they can go to a traditional registration desk. What we are doing really is learning from other industries that have been doing this for many, many years. For example, the airline industry started off with the ticket counter. They went to a kiosk, and then they're now doing online check-in. We are getting to the online registration very quickly. They never abandoned the kiosk, nor they never abandoned the desk. So those are things, an example of how we're learning from other industries, as instead of us looking within our own industry for new advice and knowledge, we're really looking outside the industry. The industries have done this better than we have. We've created this center to be a community asset. We have a fiduciary responsibility as a university to be a community partner. So what we've done with this particular center is not only deliver healthcare to this community, but what we're also using this building is a place for any patient or family, or even someone who's not a patient, but just a resident in the community, to come in and enjoy the building.
Can you give me some examples?
Yes. So, for example, we have a community partnership with Steinway & Company, the piano store. They placed a grand piano in our lobby.
Okay.
You don't have to be a patient. You can be a patient, a family member, a physician, or staff to play that piano.
Okay.
So we're inviting the community inside to really enjoy the building. I started my schooling in undergraduate. I was on the way to medical school. I was pre-med. I was working in a hematology oncology lab here at the university. And there was some advice that I took from some physicians to probably do the business side of medicine as opposed to practicing medicine. I'll tell you, that experience was incredible because it really did teach me the benefit of research to the delivery of care. I was fortunate to publish a couple papers and abstracts while I was doing some research. So then made the decision not to go to medical school and took the business route. Got my MBA and a hospital administrative degree with the general MBA and obviously investment finance. That helped me then go into an administrative, junior administrative role. I started my career at Jackson Memorial Hospital, and then joined the university in 2000, and then left for a little sabbatical and came back.